Welcome back, viewers. Today, we're going to talk about what your hair says about your health. It's true that your shiny, soft, and silky hair reflects your personality. It's also true that your hair says something about your health too. And today, we'll be listening to your hair. Let's get started. You probably think about your hair on a daily basis, fretting over bad hair, or enjoying a nice blowout, or maybe wondering whether to try out the new style that you noticed on your favorite celebrity, but you might be missing clues that your hair is revealing about your health. Research shows that changes in your hair's look, texture, or thickness can be signs of underlying health conditions. Welcome to Beyonce. If you are new here, subscribe and click that notification bell so you'll always be updated on our future uploads. Now here's how you can tell whether your hair changes are due to health problem, genetic, stress, or nutritional deficiency. Number 1. Stress can make you go gray. Have you ever pondered why your hair turned gray? Yes? Anyone who has watched presidential hair change from campaign to the campaign has noticed that stress seems to make hair turn gray, and a study on mice published in the journal Nature suggested that chronic stress may indeed contribute to graying hair by causing DNA damage and reducing the supply of pigment-producing cells in hair follicles. Stress can also cause your hair to fall out. Another type of stress, known as oxidative stress, may also play a role in gray hair. Oxidative stress may affect pigment-producing cells. Going gray is actually a totally natural part of aging, as your hair follicles produce less color as you get older. Your genes also play a role in when your hair turns gray. Ask your parents how old they were when they saw the first sign of silver, and you might follow suit. Number 2. Brittle hair could be a sign of Cushing syndrome. Brittle hair is one symptom of Cushing syndrome, which is a rare condition caused by too much cortisol, the body's primary stress hormone. But there are many other more obvious symptoms of Cushing syndrome, including high blood pressure, fatigue, and back pain. Treatment for Cushing syndrome may include changing the dose of medication that could be causing the condition, such as glucocorticoids, which are steroids caused to treat inflammation caused by a variety of illnesses. Other people might need surgery, chemotherapy, or radiation therapy to correct the adrenal gland's overproduction of cortisol. Number 3. Hair thinning could be a sign of thyroid disease. People who have hyperthyroidism, a condition that occurs when your thyroid gland doesn't produce enough thyroid hormones, might notice increased hair shedding and a change in hair appearance. About 4.6% of the US population's ages 12 and older have hyperthyroidism, although most cases are mild. It can cause thinning hair and other symptoms such as tiredness, cold intolerance, joint pain, muscle pain, a puffy face, and weight gain. A thyroid-stimulating hormone test will diagnose the condition, and treatment entails taking thyroid medication. In addition to thinning hair, certain thyroid disorders put you at risk for an autoimmune hair loss condition called alopecia areata. This type of hair loss causes round patches of sudden hair loss and is caused by the immune system attacking the hair follicles, and that's the reason why you see the head of many people partial bald. Number 4. Shedding could be a sign of anemia. If you're suddenly noticing a lot more hair in your hairbrush or on your shower floor, this could be a sign that your body has low iron stores or anemia and may warrant testing. This is another blood test that is done when you complain of hair changes. This blood test is often ordered for people who are vegetarian or for women who have heavy periods, both of which increase the chance that hair changes are due to low iron. It's not completely known why low iron can cause the hair loss, but iron is critical for many biological and chemical reactions, perhaps including hair growth. If your doctor determines that you are truly iron deficient, eating more foods that are high in iron or taking an iron supplement might help with hair loss. Hair shedding can also happen temporarily with sudden changes in estrogen levels and is often noticed after pregnancy or stopping birth control pills. Number 5. Hair loss could indicate a protein deficiency. Protein is essential for hair health and growth because lack of protein has been linked to hair thinning and loss. Protein deficiency isn't a problem for most Americans. Most adults need 0.8 gram of protein per kilogram of body weight. Good sources of protein include non-fat Greek yogurt, tilapia, chickpeas, and chicken breast. People who have gastrointestinal difficulties or who just had gastric bypass surgery may have problems digesting protein. These specialized situations will have to be managed with your doctor's help, but most hair thinning, even in women, is likely due to genetics. Number 6. White or yellow flakes could mean you have dandruff. Yellow or white flakes in your hair, on your shoulder, or even in your eyebrows is a sign of dandruff, a chronic scalp condition. Dandruff doesn't usually indicate serious health problems, and it can usually be treated with over-the-counter specialty hair shampoos or a prescription shampoo. One of the most common causes of dandruff is a condition called seborrheic dermatitis. Those with seborrheic dermatitis have red, greasy skin covered with flaky white or yellow scales. Sensitivity to hair care products and dry skin can also cause dandruff. Dandruff is usually worse in winter, when indoor heating can make skin drier, and when you curl your fingers through your hair, the dandruff can be seen on your shoulders. Number 7. Damaged hair can mask other health problems. Although hair can tattle on your health conditions, patients more commonly complain about the damage done by coloring and heat-treating hair to within an inch of its life. Too much heat from daily flat iron use or daily blowouts can certainly damage your hair, making it dry, brittle, and hard to maintain. You should be using no more than one hot tool per day, and infrequent double heat processes are okay, but not daily. Whenever you are applying heat on your hair, always use products with protective ingredients. Serums and shine drops tend to have qualities that preserve the hair when using direct and indirect heat. Getting your hair professionally colored is unlikely to cause much damage, but bleaching your hair and using boxed hair color at home can have adverse effects. You can mitigate any damage on your hair by using the right products. Post-color treatment, use proper color preserving and moisturizing shampoo. Perhaps most importantly, highly treated hair may mask certain problems and make it difficult to see or feel what your hair can tell about your health. Number 8. You're spending too much time in the sun. If your hair looks dull and weak, it could be due to sun exposure. While ultraviolet rays can make your hair look more golden, which is positive to some, overexposure can dry your strands and make your hair very brittle. If you have dark hair, your hair will be a bit more protected, but those with light hair should avoid too much exposure to sunlight since it can lead to unwanted hair damage. So never forget to listen to your hair and what they say, because if you listen to them, you won't have to stress about your health and hair problems. And last, there is one thing you need to do. That is to give us the big thumbs up, subscribe to our channel, hit that notification bell so you'll get more future tips like this one. And always remember, sharing is just one click away.